So it is 3 o'clock on August 24th, just about 24 hours since we filmed yesterday, roughly.
Yeah.
So one day.
A lot.
This is already what a day looks different.
Well, and I'll have you actually film closely maybe, but
yeah,
the suture is off for the most part. There's still like little chunks of whatever it's called.
the telfa. So the sutures are still there. I took the dressing off the top of it and cut around, what did we say, 17 staples?
A lot.
That's why I'm wearing the best husband ever shirt, because Ed was nervous to have me cut his bandages off. So joking around, this shirt is from our honeymoon. I put it on and I said, all right, the shirt says so. You have to let me cut the bandage off now.
I do love those shirts, by the way. That was fun.
That was your order.
Yeah. So really quickly, I know Jason has stuff he can probably cover anyway, but I'm feeling okay. I'm still disoriented. I'm still confused. I am noticing this shirt, and I do love this shirt. You know,
Are you looking at yourself in the camera?
Hey, I love this shirt. I'm feeling okay. Honestly, even the pain isn't as bad as I thought it would be. I'm so proud of Jason. I'm going to say that a million times. For a long time.
He did not want me having to cut that bandage off. He wanted a nurse here.
No. My real thing is that you shouldn't have to.
We're going to touch on, again, as I keep saying, caregiving in another video.
Jason can.
Yeah. Not everyone could have done what we did this morning. It was not easy.
A person should not have to.
Yep.
You shouldn't have to do any of this, but you definitely should not be a caregiver and nurse and opening this
a dressing.
Like, that's just not fair.
No.
It's not fair.
I think sometimes the system is what's broken in not providing home health aid when you go home. Yeah. But I think sometimes the medical professionals who could advocate differently, they don't think it's a big deal. I was hurting Ed no matter the best I could do, trying to cut around those staples. And I'll give you a close-up shot of his suture in a minute, and we will give a warning so you don't have to see it if you don't want to.
It's not that gross.
It's not that gross, actually. It looks like a really clean set of stitches. Yeah. But I wanted everyone to kind of see, this is 24 hours different. I know Ed is you're staring off blankly now.
I'm tired.
It's because you're trying to concentrate too. But language is better. 24 hours makes a significant difference. I mean, you've been loving getting dressed too. So you've been putting clothes on and...
A little bit of humanity makes a big difference. So that's the main thing.
So let's throw back to what we were filming yesterday and continue talking where we left off about Ed's surgery. So flashback to yesterday, and you'll get to see the difference in 24 hours as Ed picks up where he left off.
That's about me. Have a kiss?
Yeah. All right, I'll insert a timestamp now for anyone who doesn't want to see Ed's sutures up close. You can fast forward to whatever time I insert right now. That suture line looks so cool, but also so weird. And you can see the little bits of telfa that I left in all of those staples. Were you impressed to see it, Ed?
It'd be more impressive if the medical system helped, but so you didn't have to do it. They did a great job. My husband should not be the one that has to do it. That's all. All right. I'm gonna be honest.
Onward with the story from yesterday.
Yeah.
Last that I left off videoing, you were going to want to talk about your pre-op stuff on the way home, and I spoke a little bit about that. I don't know what much more there is to talk about pre-op, but I'll give a little bit of a overview. So last I left you, he was in for his functional MRI last week. And do you want to talk a little bit about the functional MRI?
Sorry, every once in a while, I get the most extreme pain, which makes sense. They literally open my skull open. And every once in a while, it is so painful.
Pain or the whooshing noise?
Both. This is pain.
Okay.
I might just readjust.
Go ahead.
Talk.
Okay. So the pain Ed's talking about is, again, because they cut into his scalp, he has a lot of swelling under the scalp, which causes pain. The whoosh he's talking about is, since they took part of his brain. It's going to fill with the spinal fluid and everything. So he can actually hear that, like I was mentioning at the beginning, where the fluid's moving in to fill everything up. Since it's right by his ear, he hears it. Weird. But you were in your functional MRI last week, and for about an hour and a half, they had him doing things with coordination, so like taking his fingers and touching like that. They had him reading words to determine if they rhymed and thinking to himself whether or not they rhyme.
I do remember that.
Looking at patterns to see if they were similar or not. So there were a lot of things where he was to look at a stimulus and process to himself what the correct response was supposed to be. And that mapped out the functional areas of his brain for the surgeon to use on surgery day. They also did a 3D kind of image of his brain that they could use to do 3D navigation.
Well, that I can't wait to see.
Jumping ahead a little bit, but I'll come back. The surgeon showed us some of it from the surgery day of like the screen that he was looking at. There's actually almost like a 3D scan of your face, and it looks like a Simpsons version of Ed. It's weird. Hopefully we'll get printouts of that.
It's pretty amazing no matter what it is. It's weird when it's you, but it's still pretty amazing.
So after the functional MRI, you went for your pre-anesthesia testing. That was probably one of the weirder and maybe scarier appointments, because they were talking to you about you were going to be under general anesthesia. They were going to put your brain in the halo. She was very upfront about what the procedure was going to be to kind of explain it to you.
Yeah, I think we talked about this before. Thank God, I don't know if that's for everybody. For us, I sort of rather be off, help me.
Up front? Is that what you're going for?
Yeah. Some people, I prefer to be up front, and look at me and say, okay, here's this thing, here's that thing, here's that thing, here's that thing.
Like, you don't want to be told everything's all right over and over again. You want to hear the steps to achieve them.
Because if it were up front and great, I wouldn't be here. That's not what I needed. I needed a doctor to tell me, wow, we can do as much as we can and get this out of you, and hopefully you'll be one day a real life. Or a healthy life.
Yes. So the anesthesia nurse kind of explained everything to us. Then the physician's assistant came in to actually lock everything down with questions. And at the time when we left, we thought you were going to be under general anesthesia.
Yeah.
We knew you were going to be woken up after the craniotomy had been done, so they could start to test, which I'll talk about some of that stuff while you were in the operating room. So again, Ed was awake for the surgery. We'll come to that.
I don't remember it.
That's great.
That's good.
So
one day I will.
Yep. So, and then they did your blood work and we headed home. So Ed was going to film on the way home after I was telling you guys that he was in for the MRI, but obviously you were exhausted that day and just wanted to kind of shut down on the ride home. So that's why we didn't pick back up on the same day.
Yeah.
Do you want to talk about surgery day now? You want to keep going or you want to take a break?
I'm so medicated. I don't remember some things.
Okay.
I don't remember. I remember going in for the room and being very cold.
So I'm going to back up a little bit.
And that was it.
Take a break for a minute and jump in where you want.
Yeah, please.
I'm going to go back to actually, so you had a 5:15 in the morning check-in time on Tuesday at the cancer center.
Tuesday the
20th.
Yep.
If my dates are wrong, sorry. I've been sleeping the same schedule he has.
Sorry.
So we had a 5:15 check-in. So we actually drove down to Tampa Monday and got a hotel. And we were very fortunate that, I'm not sure how many of you know Ed's background and everything. Ed has a sister that he grew up with, but Ed was also adopted, so he has some biological family. One of his biological brothers is in the Jacksonville area. So he and his girlfriend came down to keep me company and Ed company It was exactly what we needed. I mean, but it was so nice to have two people that could joke around with me during the surgery, joke around with us the night before. We had a wonderful dinner. We all went out to eat. So
I didn't eat.
You didn't eat. You were stressed. We ate. But it was kind of one of those blessings of someone that you never would have expected would be the person to say, we're going to be there and don't tell us no, was exactly who we needed for that.
Yeah.
So woke up at 3 a.m. So the prior night, Ed had to do a special disinfecting shower. The next morning, you remember that? Yeah. The next morning, he had to get up at 3 o'clock to do the same disinfecting shower again. So anyone who's gone through surgery recently knows what that's all about. But it's just basically a disinfecting scrub for your whole body. And then 5 o'clock, we checked in to the OR. Very quickly, they got all his registration done, took us back, and I was sitting with you in the pre-op area. And the nurses got you all started with the IV. They were telling us, about the timing of the surgery and things like that. And then very quickly and very overwhelming, the OR nurse came in. The second surgeon who was going to be assisting came in. Then the doctor came in. Then the anesthesiologist, the neurotechnologist who was going to be testing you. Ed had a team of probably about 10 people that I met that were going to be in the OR with him, and there were probably more than that. You doing all right?
Oh, I am. I don't remember parts of this. Parts of this, I'm just going to black it out. That's okay. And actually, that's why, my God, I'm fortunate that we're doing this. So, go ahead.
Yeah.
Sorry.
So, if there's anything you want to chime
I'm not
in
cutting off, or
No, you're
I'm
good.
not being rude. I don't remember parts of this.
Yep. But if you,
Some things you're actually supposed to be able to block it out, and that's okay for now.
if you do remember anything that's a detail that I don't know,
Yep,
jump in
please,
now. But this
please.
is the stuff that I was active in. And right around that 7:15 mark, I was blown away. I don't know if you remember when they told us this. They had 16 operating rooms loading at 7:15 for
Yes,
surgeries
I
for
do.
the day. 16 ORs. Mind you, 16 ORs, all with all cancer patients, cancer
Yes,
surgeries,
yep.
and all with similar team sizes to what Ed was having.
Yes.
So you were one of the first people to go to the OR.
Actually,
So-
I was the first one.
were you the first? I
was
wasn't
the
sure.
first.
Okay. So they pull us out of
I don't know what
the.
that means, but it was...
You were the first one to go to the
I
OR.
was excited,
Also, your surgery was long. It was good. You
Also,
were
they
first.
were like cheering for you in a way. Like,
Yes.
It was very cool.
Like they actually take the bed out and start to go down the
Yeah.
corridor, which is just kind of like the holding area for
and I
all the
was
pre-op.
scared.
But every bay had a patient and a team of people, and all smiles and jokes. And see, this could get me emotional too right now. Is the mentality of everyone there is there wasn't someone having like a bone repair surgery or
No,
an appendectomy.
No. It's a
Everyone was
hospital.
cancer, and everyone was in great spirits. Ooh, thunder.
See, there you go.
Yeah. See, there was someone talking from up there. And everyone there, no concern. Like, everyone said, no, this is what we do here. You don't have to worry.
No.
So, at that point, I parted ways with you. Your OR nurse, who was in charge of your OR, let me know that your doctor doesn't typically update the status board because he just focuses on the surgery.
Fine.
And that the nurse would reach out to us at points to let us know everything was going good or if they were taking longer. And he said if we didn't hear from him, that was also good. It just meant they were moving ahead.
Yeah.
So you went into the OR, and the thing we found out that morning from the anesthesiologist, which I guess was good news for your recovery too, they did not do general anesthesia for Ed.
They didn't?
No, they did local and kind of like what they do for a colonoscopy, but they put you a little bit deeper for the beginning of the surgery where they had to open the site, because then they brought you back up to be awake during the surgery. And again, same types of things.
No idea.
Hey, we don't need you to remember that. But same types of things that they asked him to do in the fMRI, they asked him to do during surgery. Can you do stuff like this? Can you speak? Can you blink? So that way, with the neurotechnologist in the room, and this was the screenshot that the doctor was showing us afterwards, they were able to see where the doctor was doing the surgery, what areas were activated right around it. And that's kind of an important tidbit for later.
Sure.
So only about I don't remember if it was 7 or 9 hours later, whatever. You went in at 7:15, and then the board said you were out of the OR at 1:30 in the afternoon. And twice during that,
Scary, huh?
yeah, twice during that, the OR nurse did call to say everything was proceeding perfectly.
Okay.
And the reason it took a little bit longer is the doctor started to get into areas where he wanted to be conservative because it was going to affect language like this.
Yeah.
So when he came to meet with us after the surgery, he let us know that Ed was probably not going to be able to read right when he woke up, and that he was going to have, hard time fishing for words because that's where some of the trickiness of the tumor was. And without getting graphic, because this was what they call a primary brain tumor, which was basically part of your brain turned sick, when the surgeon goes in to do the surgery, it all looks the same. It looks like brain. So that's why he was using all of this 3D mapping technology to know where the MRI saw the extent of the tumor, to where the function was. So he thought he was conservative, or he was being conservative in the areas where that speech stuff was in the language. So he let me know at that point in time that even if he left some tumor behind, he was very confident with what he removed. And because this is a slow-growing type of process, they could let it grow, and those skills would move again to another part of Ed's brain, and they could go get more tumor if they ever had to, or do more radiation.
Yeah.
Well, Ed woke up, got his ice cream, and they moved you over to ICU.
Partially, I remember that.
Yeah, they moved you to ICU. I think we'll kind of leave the story at Ed moving to an ICU room for now. And I just want to close with a little bit of, kind of some good news that came the following day.
Okay.
You went for your MRI post-op the next day. The radiologist read the report as a total to near total removal of the tumor. Mm-hmm. So even if there is stuff left behind to grow, it is minimal. And if they need to do radiation and chemo, he's in a good position going forward now as far as the tumor goes.
I also just want to kind of go back on that, is that they weren't sure entirely, right?
What, so, after the surgery?
Yeah.
Until your MRI.
They don't know until they know. Mm-hmm. And even still, like we said, they could find a couple things, but I've done it.
So if you needed to go for another surgery 5-10
today,
years?
No, today I can do it ever again. But one day, I can do it.
I don't think we want to do that, but knowing it's a possibility and it's not even a concern of the surgeon was good.
They were so good.
Mm-hmm.
They really were good. Okay, I think that's kind of enough for me right now. I change positions and need to be in different rooms right now because I can't. It's Florida, so I can't just walk outside, and also I can't do much. Mm-hmm. So I need to change rooms pretty quickly before I get confused.
Yep, and also you have a little bit of, on this side, vision impact on your right eye. So Ed needs to move to a different room just to have something different to look at. He did lose a little bit of his visual field to his lower right side. Yeah, temporarily. There's swelling in your brain. You basically have a concussion, more or less.
So,
yeah.
I think the main thing is we've gone through this. We've gone to the other side of this.
Mm-hmm. So with that, we'll close this one for now. Yeah. Thank you for all of the messages and the cards we've been getting.
I can't read it. If I see it, I don't know what it says right now. That's
yes,
okay.
Again, I am reading all of your comments and messages to Ed. He can't read them himself. But
what I can tell you, is sentiment. So I can tell that you were sending nice messages,
And of course, right as Ed was giving his last thought there, the battery died.
Kind of like real life, I went through a weird thing and I don't know what happened and we're starting fresh.
Yeah, so starting our close over again.
My main thing was everybody's out there for you. People you don't even know are out there for you. Reach out to someone. Someone will listen.
That's what you were saying.
Yeah.
You can't read the comment. You've all been leaving fantastic comments for us, sending messages through Instagram, sending cards through mail. Ed can't read them. But you've been knowing that the support is there. And
it actually is kind of strange because I know that makes no sense. The first day, I couldn't read anything they said, but for some reason I knew people had read messages to me. So that could make me cry. Mm-hmm. Because they sent messages, it didn't matter what it said. I felt like people were
out there for you.
People were there for me.
I want to just...
Not just me, but for him. But I was sitting there, couldn't read what it said, don't know what it said, and was getting frustrated, and I could stop. But because they were there, I knew people were still hoping for me.
When Ed was moved over to ICU that night, me and his brother went to visit with him, and he asked for his cell phone. And again, we had been told that Ed might not be able to read.
Yep.
So the first thing we did was put the food menu in front of him. Ed couldn't read. Mm-mm. So we let you know that.
I thought I did.
You thought you read. You said some words that you thought you were reading. Kind of scary in the moment, but since we knew it wasn't scary. It's still scary now when you do it. But we were able to tell him that the surgeon wasn't concerned. Again, like we were saying, he knew before he woke up that Ed wouldn't be able to read. So we brought him a cell phone, which all he could really do was look at it, but he saw all those messages that you had been sending all day. You could see the hearts, you could see the blowing kisses, and
I don't know what it said. I'm sure there are some very sweet things there, but
I read him.
It didn't matter. It was the energy that people were there for me when they could. On any way, it doesn't matter if you're spiritual, not spiritual. People thinking about me got me through that hard day because every hour someone had to wake me up. Because you're ICU. So every hour someone had to wake me up.
Yeah, we'll go into detail on that in the next video.
Yeah, but just, it doesn't matter. Mm-hmm. It means a lot. So
and
thank you. Seriously.
You can see the smile on my face about how much that meant to me. Ed is not smiling because they cut through the muscles here and smiling here. It hurts to smile.
No, I can do this.
It's a fake smile though. But
yeah.
there are times where I read him things, or we're watching your stories on Instagram, whatever it may be, where he does chuckle and smile. But generally speaking, he's got a flat face right now because, again, a scar from here to here.
It hurts.
There's a smile.
But main thing is, I appreciate you. I look forward to more. Please send more to Jason, because Jason can do it for me. But my main thing is, I will say this a million times, and I will say a million times the rest of my life, the caregivers are the ones who need more than I will ever go through.
Oh, we'll be doing a separate caregiving. I'll be telling you guys what I'm doing.
I promise you.
And he'll let you know how much it meant. So
I promise you, everything he has gone through has been 100 times more than I have gone through, because he's the one doing it.
Wait till I share my level of responsibility
Yes.
with you guys. But with that, we're going to go take our afternoon break now,
Yeah.
and we'll pick back up in the next video with
Whenever we can.
your experience in the ICU.
Yeah.
And I'll talk about caregiving probably in between. But
So, we love you guys.
thank you all for the support. Keep it coming, because it keeps
For
us
both of
going
us.
every day.
Yeah.
And I love you. I'm glad I'm
love you
sitting
so
next to
much.
you today.
I'm going to try to turn to you.
Give me a kiss. Thanks, guys.
Love you.